Good afternoon, everyone. Welcome to the Health and Social Services Subcommittee of Appropriations. It is February 19th, and today we will be hearing from the Department of Human Services, Social Services Administration. As usual, we will begin with our DLS analysis, and today we have Sam Quist with us. Go ahead. You may proceed when you're ready.
Thank you, Delegate. Good afternoon. Samuel Quist from DLS. This is the budget for the Department of Human Services, Social Services Administration. In FY 2025, the budget increases by $12 million, or 1.7%, to $731.7 million. I'd like to begin by turning to the performance analysis section, which begins on page 4, and highlight briefly 3 areas where the department has asked DHS to comment. The first is Exhibit 1 on page 5, showing performance in certain child safety performance measures. DHS is asked to comment on efforts that it is making to reduce the recurrence of maltreatment and the rate of victimization of youth in foster care. On Exhibit 2 on page 6, you can see that there's been an increase in the number of placement moves generally over the past 5 years. So DHS is asked to also comment on that increase and what can be done to prevent unnecessary placement moves for children in foster care. And Exhibit 3 on page 7 is showing the percentage of children exiting foster care to permanency within 12 months of entry. Due to the general decline in this percentage this fiscal 2019, DHS is also asked to comment on this percentage and any efforts that could be made to increase this percentage. The budget discussion begins on page 9. I'd like to first highlight that the budget includes a proposed general fund deficiency appropriation of $28.4 million for fiscal 2024. This is for the foster care maintenance payments program and is necessary due to increases in placement costs above what was originally estimated in the budget last year. Exhibit number 5 on page 10 shows the overview of agency spending for fiscal 2025. You can see that the foster care program is about $350.1 million. The category that is labeled as other in the chart, this should actually read personnel expenses. There's a slight labeling error there, but about $284.2 million is for the personnel expenses, the largest being under the Child Welfare Services program. I'd also point out on this chart that there are $8.5 million budgeted for evidence-based prevention practices and technical assistance. This will be covered a little bit more in the issues section of the analysis. Exhibit 6 on pages 11 and 12 shows more of detail about the proposed budgetary changes. Within the $12 million overall increase, about $6.1 million is the net increase to the foster care program. There are about $5.9 million of increases in the remainder of the agency budget. Outside of foster care, the largest change is a $13 million increase in personnel expenses, and under decreases, at the bottom of the chart on page 12, there's a $7.9 million decrease to the Montgomery County Block Grant. If you recall, during the hearing for the DHS overview, it was indicated that there was a budgetary error in fiscal 2024, so this is bringing spending in FY25 in line with consistent with prior year spending in that area. Under the foster care maintenance payments program, the largest increases are $28.3 million budgeted for the implementation of provider rate reform. There's also $12 million in the budget for provider rate increases. On the top of page 12, it's shown that the largest area of decrease in this area is there's $39.9 million in combined decreases related to placement costs for foster care placements, which largely offset these increases. This takes into account both the impacts of the deficiency appropriation in FY 2024, as well as some other unallocated program spending reductions in the program. By fund type, federal funds increase by about $20.2 million, which allows general funds to decrease by about $14 million. This includes additional allocation of temporary assistance for needy families funds to be used towards foster care. Further discussion about the implementation of rate reform begins on page 13 and on page 14. DHS has outlined a proposed framework for a revised provider rate structure for foster care providers through proposed regulations. It has discussed these proposed regulations would go into effect on July 1st, 2024 in corresponding to the beginning of FY 2025. And the provider rate structure that DHS has outlined goes towards more providing rates by classes of service rather than individual providers. As I mentioned in the previous exhibit, there's $28.3 million in the budget for this implementation, as well as an additional $12 million for provider rate reform. DHS, in the bold section on page 14, we are commenting on asking why there are two separate funding amounts listed for this purpose, as well as recommending that there is language adopted requesting a report from the department outlining in more specific detail how this spending budgeted in FY 2025 will ultimately be used, as well as a timeline for implementation. The next section of the analysis goes into the foster care caseloads and the DLS forecast for the foster care program. Exhibit 7 on page 15 shows that over the past 5 fiscal years, foster care caseloads have generally been declining. This is due to both impacts of the COVID-19 pandemic, as well as efforts by DHS to generally reduce the need for children to enter into out-of-home care when able to do so. In fiscal 2023, overall foster care caseloads declined by about 1.4%. However, there were increases in the individual area of purchased institution placements. These grew by about 2.8% in fiscal 2023. Exhibit 8 on the next page is showing caseload data for subsidized adoptions and guardianships. Adoptions decreased by about 4.2% in FY23, while subsidized guardianships have increased by about 2.3%. Exhibit 9 on page 17 is showing caseload projections that DLS is making for FY 2024 and 2025 in comparison to the actual data. DLS is projecting that overall caseloads will continue to decline in both fiscal years by about 1.4% in FY24 and about 0.5% in FY25. Consistent with most recent actual caseload trends, although we're projecting an overall caseload decline, we are projecting that there will be increases in the individual categories of purchased institutions and subsidized guardianships, consistent with trends through December 2023. Exhibit 10 on page 18 is showing data on placement costs for the 3 most expensive individual placement types. Overall, average placement costs for foster care placements increased by about 17% in FY23 and by an additional 8.1% in FY 2024. This is part of the reason why the deficiency appropriation in FY24 is needed due to those cost increases. Among individual placement types, as shown in Exhibit 10, the purchased institution category is the most expensive of individual placement costs. These placements increased by about 24.3% in FY 2023 and have increased by an additional 2.8% during the first half of fiscal 2024. The overall DLS forecast for the foster care program is shown in Exhibit 11 on page 19. In fiscal 2024, DLS is estimating a surplus of about $15.3 million overall. In FY 2025, DLS is estimating a smaller surplus of about $5.6 million. In FY 2024, due to the estimated surplus, DLS is recommending that the proposed deficiency appropriation could be reduced by approximately $7 million, which would still leave adequate funding to support any increases in the program through the remainder of the fiscal year. In fiscal 2025, DLS is estimating that program funding levels will be slightly more than adequate if the entirety of the funding budgeted for rate reform and provider rate increases are ultimately used to go towards placement costs. However, DLS is estimating that the fiscal 2025 budget is insufficient to provide further rate increases despite funding being budgeted in FY 2025 for that purpose. Due to reductions in other areas of program funding related to placement costs, DLS is projecting that this funding would effectively need to be budgeted to maintain current provider rates at fiscal 2024 levels, and that any provider rate increases above 2024 levels could result in a potential program funding deficit. Page 20 provides a personnel data summary for the agency. This is showing that there were about 12.9% of positions vacant at the end of calendar 2023. The largest share of vacancies were within the Child Welfare Services Program. However, current vacancy data shows that there's been about a 96 position decrease in vacant positions since calendar 2022. Turning to the issues section of the analysis, the first issue is providing some additional data on out-of-home placements in Maryland. Exhibit 12 on page 2021 is showing the number of out-of-home placements across all child placing agencies in Maryland. Although DHS consists of about 90% of children in out-of-home placements, this data also reflects children placed through the Department of Juvenile Services and in placements funded through Maryland Department of Health and MSDE. This chart is showing consistent with some of the declines in foster care caseloads. Overall, there's about a 21.5% decline in out-of-home placements between fiscal 2019 and 2023. The next item in this section I would highlight on page 23, Exhibit 14, the number of out-of-state placements occurring. These have generally declined since fiscal 2020. In fiscal 2023, there were about 278 children requiring placement out of state, and the data shows that the largest number of these placements occurred in Washington, D.C., Virginia, Florida, and Pennsylvania. I'm going to turn ahead to Exhibit 17 on page 26, which is showing data on the rates of re-entry into foster care within 1 year of exiting, broken down by the rate of re-entry from exits to guardianship, which has continued to decline, and the rate of re-entry to reunify with family of origin. In this category, rates of re-entry actually increased by about 1.2% in FY23, so the analysis is asking DHS to comment on the reason for that increase. The final three exhibits in this section of the analysis go into in-home family preservation services provided by the department. I'd highlight on page 28, these two exhibits are showing the percentage and number of children who were involved in in-home family preservation services who had an indicated child protective services finding or required a subsequent out-of-home placement in either while receiving services or within 1 year of case close. Although some of the numbers fluctuate from year to year, overall you can see that the percentages in each category are relatively low, which suggest the degree of effectiveness that these programs have in preventing subsequent instances of child maltreatment. The second main issue covered in the analysis, beginning on page 29, is discussion of Family First Prevention Services Act components. In recent years, committee narrative in the Joint Chairman's Report has asked DHS to provide a report on evidence-based prevention practices implemented. In fiscal 2023, the department reports that there were 4 main practices implemented among 18 Maryland jurisdictions, and about 319 families were served. On page 30 of the analysis, DLS is asking DHS to comment on the status of the revised public assistance cost allocation plan and the current status of the ability of DHS to receive federal reimbursement for these evidence-based prevention services. In the report that DHS submitted and in the analysis on pages 30 and 31, there's an additional discussion on the evaluation of the outcomes of these evidence-based practices, DHS reported that it found that the percentage of families completing participation in these programs requiring a subsequent out-of-home placement was generally lower than families who had not participated in the program. And they also go on to discuss more data on some of the other positive outcomes in other areas for children and families that were attained. I'm going to turn to pages 32 and 33 of the analysis, discuss Qualified Residential Treatment Programs, or QRTPs. The Family First Prevention Services Act included provisions amending the eligibility of states to seek federal reimbursement for certain non-family placements in over 2 weeks of duration, except in some of the certain circumstances discussed on pages 32, or if the provider has received a designation as a Qualified Residential Treatment Program, or a QRTP. In fiscal 2022, the first providers received QRTP designation. However, the analysis notes that in fiscal 2023, no additional providers received this designation, despite DHS, in consultation with the Department of Juvenile Services, facilitating a second round of applications from providers for this designation. On the bottom of page 33, the analysis notes that although the FFPSA does not prevent non-family placements with providers that have not received a QRTP designation, federal reimbursement for these placements is unavailable after 2 weeks, and therefore a lack of designated QRTP providers in the state limits the extent to which federal reimbursement can be sought for these placements. The analysis asked DHS to comment on future efforts for QRTP designation of providers, as well as commenting on the state's current ability to seek federal reimbursement for the funding of these non-family-based placements. The third issue that the analysis covers on page 40 is related to the Child Welfare Caseloads and Staffing Report, which has been annually requested by Narrative and the Joint Chairman's Report. The most recent report on this topic was due on December 1st, 2023. However, it was not submitted until February 6th of this year, and unfortunately, DLS did not have sufficient time to fully evaluate the data that was contained in the report, and so it was unable to include an analysis of that in this analysis. I would note that the report is available online, so if there are any specific questions on this topic, we can follow up after the hearing on that. I'd like to conclude the presentation by summarizing the DLS operating budget recommended actions, which begin on page 35. The first recommended action is to adopt budget language restricting funding until the Office of Legislative Audits has submitted a report indicating that corrective action has been taken to resolve all repeat audit findings. The most recent audit report was issued by OLA in June of 2021, and in May of 2023, OLA submitted a letter to the budget committees indicating that there were still some findings that had been unresolved from that audit. As a result, the Joint Audit and Evaluation Committee has requested that budget bill language be added for these agencies that have outstanding audit findings. Second recommended action is restricting funding pending the receipt of the Child Welfare Caseload and Staffing Report I mentioned previously. The third recommended action is to restrict funding budgeted for provider rate reform and rate reimbursements until DHS submits a report providing additional outline detail on how those funding will be used in fiscal 2025. Recommendation number 4 is committee narrative on the hospital overstays and the hospital overstay issue for children in foster care. This issue was covered in the DHS overview budget hearing. Recommendation number 5 is committee narrative on the Family First Prevention Services Act, including both discussion of the evidence-based prevention practices being implemented, the outcomes measured for those practices, and the portion about the Qualified Residential Treatment Program designation that I mentioned previously. Recommendations 6 and 7 are annual budget bill language, which has been included in recent years to restrict funding in the Foster Care Maintenance Payments Program and the Child Welfare Services Program to those purposes. which would prevent any transfer from occurring, which would result in a deficit in either program area. Recommendation 8 is to reduce the general fund deficiency appropriation proposed for fiscal 2024 by $7 million. And that concludes my presentation, and I can take any questions. Thank you.
Thank you, Mr. Quist. Do any subcommittee colleagues have any questions? You do? Oh, no. Oh, sorry. Thank you so much for your analysis. Really appreciate it. And we will now call upon our DHS presenters to join us at the table. Secretary Rafael Lopez, Principal Deputy Secretary Kenitra White, and Acting Chief Financial Officer Kirill Resnick. And while you were settling, I promised her I would do this. So I'm just going to take a moment of personal privilege to congratulate Principal Deputy Secretary White for 1 year of service in this role, but 31 years this year in service to our state through your time with DHS. So thank you so much for all of the important work you do. A little round of applause. We'll now turn it over to your team, Mr. Secretary, and you can take it from here.
Thank you. Honorable Chair Shetty and members of the subcommittee, good afternoon. My name is Rafael Lopez, and I serve as the Secretary of the Department of Human Services. We thank Governor Moore, the legislature, and all the departments for their support in getting to this moment before you. Joining me at the table, as you've already said, is our Principal Deputy Secretary Kenitra White to my right, and to my left, Acting Chief Financial Officer Kirill Resnick. We have a variety of senior members of our leadership team with us here as part of the squad in case we need to rely on them for additional answers to questions. We want to take this time to highlight 8 key areas reflected in our proposed budget that help us begin the launch of a new era of child welfare in Maryland. Number 1, the importance of implementing the Federal Family First Prevention Services Act in Maryland. Number 2, ending the practice of youth aging out of foster care in the state. Number 3, creating a kin-first culture. Number 4, reforming how Maryland compensates care providers. Number 5, addressing hospital overstays. 6, addressing hotel stays. 7, course-correcting MD Think. And 8, rebuilding state government. On the first matter of implementing the Family First Prevention Services Act, we want to first and foremost say that we want to prevent any child from having to come into foster care in the first place, and doing all that we can to make sure children and youth can safely remain with loved ones. We want to reduce unnecessary removals and leverage federal funding to do so in the most effective and evidence-based way based on science, data, and common sense. We're committed to providing family-centered, child-focused, community-based services that promote safety and child well-being and strengthen families across our state. We will lead these efforts to leverage additional federal funding to support innovative foster care prevention services for Marylanders grounded in community. For many years, DHS has not drawn down tens of millions of dollars in available federal funding to expand services for families in crisis. Early in our administration, we partnered with 2 major national foundations, the Anna E. Casey Foundation and Casey Family Programs, to help us implement best practices from across the country to specifically leverage the Family First Prevention Services Act. In 2018, FFPSA, as it's known, authorized states to use federal uncapped entitlement funds for time-limited foster care prevention services. The goal of this law is to prevent unnecessary foster care placements by proactively addressing the top 3 reasons nationally, also in Maryland, for why children come into care. 3 of those reasons are substance use disorders, mental health challenges, and the challenges of parenting, all while drawing down federal funds for innovative services to help keep kids with their families. Maryland has not seized the day because DHS has not drawn down a single dollar in these federal funds. And that's in spite of having a federally approved plan since 2019. So we're obviously moving with great urgency to turn this around. We estimate nearly $10 million in federal Title IV-E funding to prevent foster care was simply left on the table over the past 5 years. To draw down more federal funds for which Marylanders are eligible, we will also improve how we identify children who are eligible for these federal funds when out-of-home placements are in fact necessary. For example, DHS could increase its Title IV-E foster care administrative revenue by $1 million a quarter or $4 million per year. We recently discovered that there are 1,508 pending 4E determinations, and of those, 790 have been in process for more than a year and still pending as we came into office. If just half of those pending determinations were completed, the federal share of our cost would increase by 5%. And this is just the first step of acknowledging publicly that we have work to do to turn this structure around to make sure we're leveraging every federal dollar for our children and families, and to be specific, leveraging our general fund dollars and being responsible to the Maryland taxpayer. To be clear, this is not about money, though. This is about the lives of children and families and what we're doing together to make sure we're investing every possible dollar to support children and families. On the second item of ending the practice of youth aging out of foster care in this state. Despite reducing entries into foster care over the last 10 years, we've learned that 64% of youth entering care at age 14 or older aged out of Maryland foster care. This is as of fiscal year 2021. Nearly twice as many older youth aged out of foster care in Maryland as compared to national data. And in Maryland, when kids enter foster care as teens, they are 40% less likely to reunify with family as compared to national data. As you can imagine, connection to family, by blood or by choice, matters whether you're 18, 19, 20, or 21 years of age, because none of us had it all figured out at that age. Why would we expect that children in foster care in Maryland do? But in fact, we have to do more to support them. Non-Hispanic African-American girls are disproportionately aging out of foster care in Maryland because African-American teen girls enter foster care at higher rates and are less frequently reunified with family. This is simply unacceptable, and we are moving with a new kind of urgency to turn this practice around in the state. Implementing Family First is the first step to reducing the number of African-American teen girls that are coming into care by preventing entry into care in the first place. We don't want young Black teen girls aging out of our care, or any teens for that matter. The next step is to ensure that teens are placed with kin by creating a kin-first culture in all 24 jurisdictions across this entire state, where we see family, again by blood or by choice, as the way to connect our kids to family, to community, and to culture. And when we think about developing a kin culture in the state, one of the things that I'm very honored to do in this role is to have partners in crime who see this work very similar to the way I do. And when Governor Moore called me to join the administration, after saying yes to the governor, one of the first calls I placed was to Carnitra. And the reason for that is because she has uncompromising values. I don't have to convince her of doing right by kids. And she also is someone who lifts up the story of kin culture in her own narrative. With that said, I'm going to turn it over to our Madam Deputy Secretary so she can walk us through the next couple of components of our testimony.
Thank you, Secretary Lopez. Madam Chair, members of the committee, once again, I'm Carnitra White, serving as Principal Deputy Secretary. It's great to be here. Some days I don't know whether to thank Secretary Lopez for making that call or not. But it wasn't an automatic yes when he first called me. You know, as the chair mentioned, at that time, I was approaching my 30th year of service. And that was service to DHS. I started out in Baltimore City DSS and had a number of opportunities throughout the career. But after soul searching and reflection, I really wanted to end my career by helping rebuild the very department that I had spent my entire professional life in. And so I've borne witness to both good and not so good administrations over the years. But one thing that I've always remained passionate about, and that's Maryland's most vulnerable asset, and that's its families and its children. And so, as many of you know, I spent 8 years working in the Social Services Administration as their executive director. And when I left in 2014, we had just received a federal waiver, which poised us to build a continuum of care to reduce the number of children in our foster care system. And what compelled me to make the decision to return is what I watched for 8 years. But in no way did I imagine what I'd walk into. In just a few short months, our team has begun to turn things around. In fact, one of the key items that we are urgently moving is the importance of building a kin-first culture, which you heard the Secretary mention. And children, when they can't remain home safely, both research and common sense tell us that out-of-home placement with kin, both biological as well as chosen, is in the best interest. And I'm sure many of you may have that same experience in your own families, kind of like me. So as a matter of personal privilege, I'm a kin mother, and now a kin grandmother. And I have plenty of pictures on my phone to show if you'd like to see my baby Sequoia. But not only am I a kin parent, my grandparents were kin parents. So it's what strengthened our family It's what kept safe my cousins and what has kept safe my daughter, and kept them connected to who we are as a family. And not only does my family deserve this, every child deserves the opportunity to grow up in their own family, in their own community, and know who they are at the root of who they are. And so that's what this whole Kin First culture is about. It really is the belief that children deserve to grow up with their own family whenever it's safe possible to do so, and that we are obligated to make that happen for our children. And currently, we have 23% of all children in foster care in Maryland who are placed with kin. There's much opportunity to do better, to support kin in different ways. All kin don't need the same supports, but we need to make sure that we're supporting kin so that they can support their children. So one of the strategic ways that we can proactively, and this is one of the ways we can strategically address the racial disproportionality you heard the Secretary talk about in our system for Black girls aging out more than any other in the system. And so we are working with the chairs of the judicial committees in this session to bring our Kin First proposals to the table and given welcome changes to the federal rules. The federal rules have now changed to better support kin, and Maryland wants to be right in line to do that urgently, working to update our policies as well as our practice. And I'm happy to report that in Maryland, we will pilot a new kin-specific licensing practice in Baltimore City that will help to inform our statewide practice, and that is on the way now. That is in progress right now. Now I'd like to talk a little bit about reforming how Maryland compensates our care providers. Maryland has failed for well over a decade. Way back when I was the Social Services Executive Director, we were working on rate reform, restructuring our provider rate structure to align with actual cost of care, provide flexibility for the specialized services, and to capitalize on federal funding. And so we're working to transform that structure to better meet the needs of Maryland's children and families by raising the bar of excellence. We believe that our children deserve excellent services when they're placed, no matter where they're placed. And so we estimate, as the Secretary has mentioned before, that we've lost nearly $10 million in federal funding over the past 5 years because Maryland hasn't kept up with the standards of the national funding. But we're changing that as we speak. And for example, in 2007, Maryland had over 10,000 children in its care and custody. Today, we have 3,804. While the number of children in foster care, any number, is too many, we were very intentional about how this reduction took place. I don't know if anybody has been around or were around back then when this whole thing called Place Matters, when we really began to talk about the Place Matters effort. That effort closed our front doors. We really helped prevent children from coming into care, but we did not do enough to build out the continuum of supports of services that we have for the children and the families. So while we're proud of that success, we will build a system that adapts to change. For example, children who are coming into our care now have more complex behavioral and developmental needs. We need a system of care that can respond to that. As group-based placements decline nationwide, we must be more vigilant to ensure that youth receive appropriate treatment services in our state. Since coming into office, we've moved urgently, identifying regulatory and budget needs to initiate rate reform as a key lever among many changes that we're implementing. In January of 2024, we submitted regulatory changes for approval and an our state budget submission for FY25. We will deliver a class-based rate structure to improve providers' ability to serve families while meeting critical gaps in Maryland's continuum of care, while maximizing federal dollars. We will. Most importantly, children and families will experience more appropriate, higher quality, and tailored service with shorter length of stay. We must do right by Maryland's children and Maryland's families. When rate reform is fully implemented, we project that we will draw down $10.5 million in federal funding for direct care costs, and an additional $7.6 million in Medicaid reimbursement for clinical services. The governor's budget proposes $28 million investment in rate reform. This is an historic investment for DHS families, for DHS, for our providers, and for the children and families we serve. And so with that, I will turn it back over to Secretary Lopez to go over the next items.
Thank you so much. It's an honor being in this work with you. One of the things that's important about rebuilding trust and reestablishing strong working relationships is to also talk about the things that are difficult, right? And this is the fifth section around addressing hospital overstays. And one of the 12 Moore Miller administration values is to over-communicate and to be transparent, honest, and open. With that in mind, we must be frank with this committee and the legislature writ large and the people of Maryland about the importance of addressing hospital overstays and also trying to be much more transparent than has been for the department around what we're doing. And so failure to modernize Maryland's care provider payment structure resulted in a mismatch between what children need and the available residential treatment center beds, or RTC beds, in Maryland for youth who require more tailored solutions to address complex treatment needs. Youth unnecessarily remain in restrictive hospital or treatment settings when there is not a safe and appropriate, less restrictive setting for them. A hospital overstay, for the record, occurs when a child in our care and custody remains in a hospital or other acute care facility 48 hours after a medical discharge has been made. As of today, there are 21 youth in what is called overstay status, awaiting appropriate placement, which equates to 0.5% of all 3,804 youth in care. To be clear, 0.5% is too many. But we also, knowing that it's unacceptable, have to be relentless around generating new solutions and being wed to the solutions and not simply to the problems. From October 2022 through September 2023, the number of children in foster care accessing inpatient psychiatric services increased by 23% over the same period in previous years. The increase reflects the complexity of youth's needs when they must come into care because in-home services or family-based care are not appropriate. In the same period, prioritizing our work with hospitals and providers to reduce overstays led to a 23% decrease in the length of youth overstay within inpatient psychiatric care. We are working to eliminate hospital overstays in a variety of ways, and I want to lift up a couple of them for you. One, participating in weekly interagency meetings with our colleagues at the Maryland Department of Health, and within them, the Behavioral Health Administration, Developmental Disabilities Administration, and the Department of Juvenile Services. And this work has identified strategies to proactively address youth in hospital overstay status. Second, weekly monitoring of all overstays, checking on placement efforts and following up on contacts with providers. And to be clear, there's a crew of us that look at this data not every week, but every single day to make sure that we're following up on the status of what's happening to our children across the state. We have begun to expedite contracts with out-of-state facilities when and where appropriate to minimize an overstay and meet the immediate and hopefully short-term needs of children and youth. Early in 2023, we dedicated a youth hospital liaison position to work as a mediator between the hospitals, local departments, and the providers. And we're also coordinating with the Developmental Disabilities Administration to place DDA-eligible transition-age youth with DDA-licensed providers. While none of this is perfect or quick or overnight, we simply can't move fast enough to course correct the last couple of years. And we want to note that youth committed to the state's custody and care should be placed in the least restrictive settings that meet their needs. Science and common sense back this up. And it would be remiss if I didn't note that the state of Maryland appropriately moved to reduce the number of children that were in out-of-state placements many years ago, and that's a laudable effort. At the same time, however, we didn't build as a state a place to actually make sure that we had a full, robust continuum of care to meet those changing needs. That's what we're doing right now to course correct. Last year, DHS and our colleagues in the Department of Health were sued in federal court over hospital overstays. To be clear, the state of Maryland is the only state in the nation with 3 concurrent child welfare-related class action lawsuits. None of this happened overnight, and it's going to take some time to turn this around, even though we're moving with great urgency. Our actions within this last year alone demonstrate our commitment to move with integrity, with urgency, and to challenge the status quo to generate new solutions. We are holding ourselves and our partners accountable to a new level of excellence to respond to these challenges. And that leads to the 6th item around addressing hotel stay trends. Similar to our hospital overstay status, there have been long-standing issues existing with youth staying in hotels. This is a nationwide issue that child welfare administrators across the country are addressing. Here in Maryland, as of February 16th, 2024, there are 54 youth in hotels rather than a foster care placement for an average of 62 days. And again, let me be clear on the record. Hotels are not foster care placements, ever. And anyone who assumes that living in a hotel should be, quote, the way things are in Maryland is sorely mistaken. Over the last year, on average, 19 youth began living in a hotel in each month of 2023. 17 of the 24 jurisdictions had at least one youth in a hotel at some point during the past year. And during calendar year 2023, there were 201 instances where youth spent at least one day in a hotel due to our inability to identify a long-term placement. The average length of stay for all youth who were in a hotel during calendar year 2023 was 61 days. And here's what we're doing about it. Our SSA team works closely with the departments of social services across the entire state to help prepare and review referral information and to identify potential appropriate care providers in state as well as out of state. Our team often engages providers to reconsider a previously denied referral and identifies additional support where appropriate, like assigning a one-to-one adult caretaker to ensure youth are safe, can help with transportation and or education supports. In addition, we continue efforts to expand the provider network and capacity of licensed providers to better meet the needs of youth. Our Principal Deputy Secretary spoke of that, the importance of investing in rate care reform to expand our continuum, again, from the range from kin to providers chosen by blood or by choice, making sure most kids do not enter care, and if they have to enter care, to not be in hotels or hospitals. Building out that continuum is what we're doing now. Whether being honest about hospital overstay status or hotel stays, what strikes me interesting is this notion I hear repeatedly across the state that Maryland is in a placement crisis, quote, end quote. Let us be clear. The idea is grounded in rumor and not in fact. Let us start a new rumor, which is one that Maryland is being audacious, courageous, and solving these challenges once and for all. On to the seventh item, which is about correcting MD Think. In previous hearings, we've shared with you and with others the steps we're taking to course correct MD Think. But specifically for this hearing regarding the Social Services Administration, we want to focus your attention on CJAMS, which is the Child, Juvenile, and Adult Management System. That's the system of record for all of our kids and young adults in the care and custody of Maryland. CJAMS has not been working as it should, whether for our providers or the thousands of our state team members who must use it every day to do their jobs to serve Marylanders. Upon discovering these issues, together with my colleagues, Secretary Horace Scott and Secretary Savage at DoIT, we responded with immediate and decisive actions, including key leadership changes to MD Think, daily operations, hiring a new executive director, Pat McLaughlin, rebuilding his leadership team, increased accountability for project design and budgets, as well as identifying and prioritizing specific steps needed to fix CJAMS itself, which ties to every single data point that we're talking about with you today and moving forward. This isn't just about getting the tech right, though. It's about getting the culture and the practice right in the state to make sure that we can effectively use data to drive our strategy, answer questions in a timely and live way, and move forward on behalf of kids and families. The final section we'd like to highlight for you is about the importance of rebuilding state government. None of the work we've noted in the previous sections can be done effectively without the hard work and dedication of our team members across all 24 jurisdictions. Governor Moore challenged us to reduce state vacancy rates, and that's exactly what we've done at DHS in this year. We spent the past year moving with urgency, and as of January 1 of 2023, our vacancy rate for our department was 15.2%. On the last day, December 31st, 2023, it was 9.69%. We reduced our vacancy by 5.5%, which equated to 338 net gain of filled positions. We're also driving those numbers down in SSA specifically to help us tackle the very challenges we've lifted up. We're pleased to share that in calendar year 2023, we had a net gain of 88 new child welfare and adult services caseworkers and supervisors, reducing our program vacancy rate by over 5%. And while we will continue to closely monitor this and align our staffing ratios for local departments with national standards based by the Child Welfare League of America, we simply cannot move fast enough to continue this momentum. With that said, we're grateful to each of you who have built this budget in partnership with us over the years. We know we want to continue advocating tirelessly for Maryland families and children to deliver bold, innovative solutions. With that said, I'm going to turn over to our Acting Chief Financial Officer to briefly summarize our responses to the DLS analysis.
Thank you, Mr. Secretary. Thank you, members of the subcommittee. For the record, Kirill Resnick, Acting Chief Financial Officer. I'm going to quickly try and address the questions posed by DLS In summary, obviously, in front of you is our testimony where there's a lot more detail, and I encourage you to look at that and let us know if you have any questions moving forward. To question number 1, asking us to comment on the efforts that we are making to reduce the recurrence of maltreatment and the rate of victimization of youth in foster care. DHS has continuously remained above the national standard of 90.5% for avoiding recurrence of maltreatment. In FY23, Maryland was at 93%. We are working with local departments of social services and community partners to implement the federal Family First Prevention Services Act to develop community-based services that support caregivers in the areas of substance use disorder, mental health, and the challenges of parenting, which address some of the top reasons why children enter foster care. To question number 2, asking us to comment on the reasons for the large increase in the rate of placement moves over the past 2 fiscal years and the steps that we are taking to minimize those placements. As mentioned by the Secretary, there are limitations that we have within MDThink and the CJM system that help us to quantify the placement moves due to constraints within those systems. To address those constraints, we are developing a metric to track placement changes within specific timeframes. However, we know that many youth that enter out-of-home placement come to us with behavioral health and developmental needs, which require a short-term, high-level placement initially, and then a step down to a placement with lower levels of restriction. Another example of why a placement change will occur is when a child moves from a foster home to a kinship caregiver placement. Again, every one of these is considered a move, and so we have to track them, which increases the number of moves within the system. Question 3, asking us to comment on the reasons for the continued decline in the percentage of children exiting foster care to permanency within 12 months of entry, and our efforts to increase that percentage. 64% of youth 14 and older aged out of Maryland's foster care system in FY21, as of this report, which is nearly twice as many older youth compared to national data. We are engaging with youth, staff, and community partners in pursuit of our goal with no youth age out of care in Maryland. First, we are implementing the Family First Foster Care Prevention Services to reduce the number of older youth requiring foster care in the first place. We are developing a kin-first culture, as mentioned earlier by the Deputy Secretary, to ensure that children and youth have permanent family connections and reduce the length of time children are in foster care. And we're actively building our family finding strategies and supporting kinship caregivers. To question number 4, asking us to discuss the status of legislative grants and where these the distribution of those grants. In the 2024 budget, there were $700,000 in grants that were provided, the largest of which, $500,000, was to Paths of Families, which is formerly known as Adoptions Together. That contract was executed earlier this year and moving forward. $150,000 was awarded for respite care services out of the Baltimore County Department of Social Services, and $50,000 was awarded to support children in foster care, recruit additional families, and return current families with a grant agreement to an organization called Concern Professional Services for Children, Youth, and Families. To question number 5, asking us to comment on the planned use for the $28 million budgeted for rate reform. That investment supports the new placement provider rate structure to align rates with actual costs of care, provides flexibility for specialized services, and leverages federal funds. The $28.3 million will support rate reforms for 62 residential child care or group homes. The new rate model moves RCC rates to a class-based model that was built on real cost data from the Department of Labor and provides experiences. In addition, there's a reference to $12 million designated for the IRC rate increases that occurred in FY24 to all contracted providers with IRC rates. This allocation is to maintain those additional costs moving into 25. This is not part of the fiscal note for rate reform, however. The new model rates cost was calculated based on 24 IRC rates. To question number 6, or to the DLS recommendation in question 6, recommending a reduction of $7 million from the deficiency appropriation. We respectfully disagree with this recommendation. We have worked over the last year with our state agency and provider partners to fill critical gaps in Maryland's continuum of care for youth with complex physical and psychological needs. The rate structure and its success relies on the total amount of funds in the governor's budget. Any cut will negatively affect our ability to implement this reform, jeopardize the model we are building to be responsive to children's needs, and place the state at additional legal risk when appropriate placements are not available. As mentioned by the Secretary earlier, the state of Maryland Department of Human Services in the state of Maryland is the only state in the United States currently litigating 3 separate class action lawsuits with regard to child welfare. To question 7, asking us to comment on the reason for the increase in the rate of reentry into foster care for children. There has been a consistent decline in the rate of reentry into foster care for children who reunify with their parents. However, much more must be done to offer post-reunification services to prevent families and prevent reentry into foster care. Though our Family First Prevention Services Act foster care prevention efforts, through our efforts, we will expand the continuum of care by increasing the availability of supportive services for reunified families. To question 8, asking us to comment on the status of the approval of our revised cost allocation plan, or CAP, and the ability to seek federal reimbursement for the evidence-based prevention services. Department of Human Services amended its public assistance cost allocation plan to add Title IV-E prevention services caseworker activity to the social services time study and to add 4E prevention service cost centers. These updates to the CAP have not yet been approved, have not received final approval from the federal government. However, DHS has submitted claims based on the proposed plan, and these claims have been paid. At the moment, the Department of Human Services, Health and Human Services at the federal level is about 2 years behind in approving our cost allocation plans, but we have been given the permission to move forward until we hear otherwise. To question 9, asking us to comment on planned future efforts by the QRTP designation work group to solicit applications for additional QRTPs. We anticipate that in FY25 there will be 8 providers with the designation of QRTP. The additional providers will submit applications with their FY25 budget request due on February 5th. That was due on February 15th. There are an additional 7 providers receiving individualized technical assistance to meet the QRTP criteria. To question 10, and DLS's recommended budget language withholding funds until an updated report containing requested data is submitted on September 1st. DHS is pleased to provide this report. However, we respectfully disagree with the withholding of funds as it will delay the implementation of rate reform. To the 4 or 5 proposed recommended actions, the first being a additional language to the general fund appropriation with regard to audit compliance. The department respectfully disagrees with the proposed action. The department acknowledges the importance of eliminating repeat findings and has implemented numerous corrective actions. However, there is no guarantee that these corrective actions will adequately address years of systemic deficiencies. Further, restricting expenditures of administrative appropriations will have a major negative impact on our service availability. To the second recommendation, adding language to restrict $250,000 until a report is submitted on the number of child welfare service cases and positions. We are happy to provide the caseload report. We have provided amended language with regard to the categories within the requested report that better aligns with our structure and roles. As to the proposed withholding of funds until the report is submitted, we respectfully disagree with that. We would obviously happy to provide the report, but do not see a need to restrict funding at this time. To the third recommendation, restricting the $40 million for rate reform to that purpose. DHS disagrees to provide the requested report within the stated time. Agrees to provide the requested report within the stated timeline. However, DHS disagrees with the recommendation to restrict funds, as with the other recommendations. On question 14, adding narrative on hospital stays by youth and out-of-home placement, we happily agree with adopting this recommended narrative and will provide the report as necessary. To recommend the next recommendation, including narrative on the Family First Prevention Services Act. Again, we are pleased to provide this report and agree with adopting the recommended narrative. And to the next recommendation, adding language to again restrict funds to their purpose. As stated in the budget, we again respectfully disagree with the recommendation. The foster care maintenance payments are directly implicated in our class-based care provider rates. Restricting those funds will negatively affect the ability for us to implement rate reform. To the next recommendation, adopting language to the general fund, restricting, again, foster care maintenance plans, maintenance payments. same recommendation. We respectfully disagree with the recommendation and ask that you not restrict our funds. And then finally, reducing a portion of our general fund deficiency appropriation, as stated earlier, we disagree and request that you not restrict any of our funding for rate reform. The negative effects will upend all of what we're trying to do. And I will add very quickly, with regard to this and all the other budgets that we're hearing, we are happy to submit any report, data, and any other information that either the legislature or DLS asks of us. I think over the last year, we have demonstrated our ability and interest in cooperating with all of you with regard to these reports. We're happy to continue to do that. Restricting funds, I think, has shown to not be necessary, at least with the current leadership of this department. So we ask that you not restrict funds with regard to any reports, studies, or information requests that you all have. So thank you very much, and we are open to any questions and request that you support the governor's budget.
Thank you so much, DHS team. Really appreciate your thoughtful response to the DLS analysis. So do any subcommittee members have questions? I see Delegate McCaskill.
Good afternoon, everyone. Thank you, Madam Chair. So I just want to say for the record that I commend the department's efforts of all that you all have done and are doing on behalf of Marylanders. I kind of get in awe when I see you all work together. And I know I can tell that's exactly what you all are doing as a department. So congratulations to that. To my question, I also want to commend the department for seriously reducing the personnel numbers of vacant positions in the past year. I think it's down to, it was almost by 100. And so my question is, I'm referring to page, I think it was 120, and forgive me because I just got my glasses. So I'm looking at I was looking at the personnel data. So the level of vacancies that remain is 115 about, which is greater than the number needed to meet the budgeted turnover expectancy. So could you give me comment on the steps that the department is taking to fill the positions?
Sure. One of the things that we're doing is trying to position DHS as an employer of choice versus an employer of last resort, which is a cultural shift, to say the least. We are trying to also exercise authorities that exist in the state of Maryland that we hadn't done before. So one very concrete example is that we learned that we can employ what's called same-day hiring. That had never been tried before. We tested it out quickly, and lo and behold, people like to be offered a job on the spot, pending final, of course, investigations, et cetera. But our human resources team worked closely with directors of local departments of social services as full partners, tested out going to career fairs in a variety of ways, engaging new people in new ways, and interviewing people and then offering them a role specifically to reduce these things. These two examples are just two of the many kinds of strategies that we're trying to employ. A bunch of us filmed on our own a little video about joining our team to try to just be creative around using ways to use video. We have a whole bunch of other strategies to try to show people that we are trying to approach working with DHS with a new kind of energy and vigor to serve the people of Maryland and model what the governor and lieutenant governor said about having Maryland be a state that serves and to lead with the fact that service will save us. So we're trying different strategies, Madam Delegate. Some of them work more quickly and more effectively than others, but that's sort of the tip of the iceberg. We're also really trying to focus in on how could we make sure we're bringing people on at the highest possible grade in terms of compensation, and lo and behold, that has also worked. I think overall as a state, as you well know, and that's something the state's trying to do as the administration continues to negotiate union agreements. But part of that is, again, within the limits of our abilities, testing them out and pushing our boundaries and being as creative as possible on the Human Resources Fund. So hopefully it'll give you some idea of what we're trying to do to change the culture around and practice of engaging more people more proactively.
Thank you. Wish you all the best.
Thank you.
Thank you. Thank you, Madam Chair.
Thank you, Delegate. Thank you, DHS team. Vice Chair Jones.
Thank you so much, Chairwoman, and thank you all so much. I am going to cash in, I think it's a one-time coupon as Vice Chair for personal privilege on so many topics. I care about this so very much, and I unfortunately cannot hide my deep respect for what you are doing. I heard a phrase that struck me from my friend, and years of systematic deficiency. And I think so much of that is at the root of what we are doing. And Deputy Secretary White, thank you for sharing what kin culture has done for you. My husband very much credits every day his success to the fact that he and his sisters being raised in a single mother home, farms kids, and at times needing government housing, to a grandmother that too was able to step in. So thank you for all of those. I have many questions for which some of you have answered on some of these. And this subject being so close to my heart, many moons ago in another millennium, I had been involved in an organization called New Pathways. And being that close to this was something that has stayed with me all of these years, even though I'm an old lady now. So I do have some questions regarding, you had mentioned the hotel placements. Can we just touch upon that,
Sure.
please?
Absolutely.
Hotel placements for children for whom have no available placement, right? You talked about the one-on-one staff to support them. Do we know how much that one-on-one staff runs?
We do. And I don't want to underestimate the cost, because so far this has been born out of 100% general funds. So one of the things our team has done, for example, is look at the cost. We know it's millions of dollars per child. So when we think about the cost to do that, we're talking about having someone like, if 13-year-old Dana were the child, you need to have in this case, a female one-on-one. And what if Carnitra has to go to the restroom? You need to back up. So thinking about literally from food and transportation to education, the time intensity it takes, one, we argue, both the science and common sense says, make sure they're not in the hotel in the first place. So that's what we're trying to reverse engineer, is making sure we don't have to have a situation where 13-year-old Dana is in a hotel at all. And then if that's the case, looking at as ways in which we can more effectively cover those costs, right? So what we're also doing is looking at, I have in front of me, for example, something we're tracking now, which is every single jurisdiction, how many kids per jurisdiction are in hotels, how long they've been there. That should be, for example, a reflection of not rocket science, but the way in which we lead and the way in which we are doing our work. So we're taking a multi-pronged approach on the issue of hotel stays. Number one, making sure that they are an exception, not the rule. Again, though I think the number was 54 that I mentioned, it's 54 too many, and making sure that we continue reducing those. The cost is far greater than we have imagined, and we are actually trying to do a better analysis of that so we can also figure out how to leverage federal dollars wherever possible. Did you want to add something?
The only thing I'd like to just add and maybe dispel this, I guess, public kind of thought that the department, that hotels or even hospitals are a choice of the department. As a former local director of social services, those were the children we spent most of our efforts seeking placements, calling every available provider in state, my resource workers researching out-of-state placements and really making an attempt, every attempt possible. I recall, and Rachel can be my witness, we had one youth who we called every kin and asked them, we will pay your rent, we will do, all of these things to support our services, because we don't sleep well at night when a child is not in, when a child is in a hotel. We don't sleep well at night. And so I think no one cares more about getting youth and children into appropriate placement than that caseworker, than that supervisor, than that assistant director, and that director. We work tirelessly to do so, to make sure that they're safe. So I just wanted to add that point of personal, actually, experience of having done this and actually not sleeping at night and my assistant directors not sleeping at night because we are just on pins and needles and wanting to make sure that we are doing everything we can to get a child in placement. And we've been working with our providers, and that's why rate reform is so important to us, because when I mentioned about the specialized services and being able to craft specialized services for these youth who have complex needs, rate reform will help us to do that.
To that point, I want to draw attention to two additional items. As you can see, we're really trying to reimagine the strategy here. So, for example, to the Anne Arundel County example that Carney just mentioned, as of the 16th of February, we know for a fact that there are 0 kids in any Anne Arundel hotels. That doesn't mean it doesn't happen, right? And so we are looking at every day. And then why are there inconsistencies across the 24 jurisdictions? Why are some kids staying longer than others? How do we reverse engineer that? They don't have to be in a hotel, for example, and those costs. Related to the costs, as addition to, for State of General Fund dollars, we have a statewide contract, 101 provider contract, that we're actually taking a really close look at. We mentioned to you in a previous hearing around the importance of including outcomes and results in all of our contracts. This is one of the cultural shifts that DHS, along with many of our sister agencies, are doing, to expect a different kind of engagement, so that we're looking at both being efficient with the dollars, but also being responsible in a very different way when we do have to have a child that's experiencing a hotel stay. So the combination of policy changes, practice changes, and people changes, like who we engage to actually help us take care of our kids in care and custody, matters immensely. So by this time next year, we hope to come back to you with the results of trying out pulling those different levers. We think we'll actually make even more progress. And this isn't easy work, given the complexity of what we're finding. But again, I want to say for the record, no hotel is a placement. We don't want kids in hotels. And there have been some who have advocated for children being placed in hotels across the state. I kid you not. So changing that culture isn't just a hearing conversation. It's a deep-rooted cultural issue in Maryland.
I thank you for that, Secretary. And just to drill down, you said 54 children were the total number of hotel placements in Maryland, or was that the total number of children with multiple placements? I can tell you right now exactly.
So what we're doing is every time we do a hearing, we do our comparing numbers. Let me make sure I don't read hospital overstays. Hold on a second. Here we go. As of February 16th, in the entire state of Maryland, there are 54 youth in hotels rather than a foster care placement. And of those children, 54 and young adults, it was for an average of 62 days.
Thank you. I would like to now make a hard shift to another question, if that's okay. Let's go to page 9 of the analysis. It notes that the department is proposing a little over $28 million in deficiency appropriation for FY24. It's again we're having a discussion about the general fund to support the foster care maintenance program. DLS also notes that the deficiency is unallocated among individual foster care placement types. Can you provide more information on this?
Sure. So as part of the rate reform that we are doing, it's going to cross the different types of settings. So we are not allocating the specific 28.6 million, 28.4 million across those different types. We are using it to implement a across-the-board rate reform system.
Okay.
I will say, because it's important, just to channel the CFO here for a second, which is that this is a down payment on a multi-year investment. This investment will not solve it all. It's 1 year of the beginning of change.
Okay, thank you. Let's flip to page 12. The analysis, it notes that hospital overstay costs for non-medical needs increased by just under 400,000. What accounts for the increase? 393.
393.
Oh, there we go.
Yeah.
So the quickest way to think about this, Madam Delegate, is actually the fact that we've been covering all these costs mostly by general fund. And so if one could imagine that we were leveraging every possible federal dollar, we were partnering as effectively with our sister agency, the Department of Health, for the drawing down of Medicaid dollars to appropriately fund clinical services, that umbrella would totally reduce the amount of funds that we spend from the state general fund. The fact is, as we walked in and looked at the analysis of the money, we learned, unfortunately, that we were pretty much covering most of these costs by state general fund dollars. So we're doing a lot more to figure out how might we leverage Medicaid, how might we leverage other federal dollars to reduce the total burden on the state general fund while providing the most set of robust, least restrictive services for children.
Okay, thank you. And I apologize. One last one. 'Tis the season to be in 3 places at the same time in this building, as you saw when I walked in. Later in the very early evening, very late on Friday, I was having a conversation on this subject with some folks who I was meeting with in my office, and they brought this up. Is it true that foster children are not eligible, it sparked my memory, for Medicaid 1915I program?
1915I waiver? Is
Yeah.
that what they were talking about? So there have been, that's not true, but there have been some challenges in the 1915I waiver that we are working with. You know, I would say I've been in this position before. I've never had such a great working relationship with my partners at behavioral health as I do now. The Deputy Secretary of Behavioral Health and we meet regularly. And so part of what we are looking at are changes to the 1915I waiver in order to expand that to reduce the barriers of access for all children, including children in foster care.
Not only is our Principal Deputy Secretary 100% on point, I would be remiss if I didn't lift up the leadership of Secretary Herrera Scott. She has come into the role, and to your question, noticed that the way in which the Department of Health would like to reimagine the Medicaid waiver for the state of Maryland requires some significant realignment. This is one piece of that realignment. So we joke with Cornita that she and the Deputy Secretary are new besties because the departments are playing better in the sandbox together. It'll take time. It will take time to have it infiltrate all departments and all levels of the administration. But reimagining the state of Maryland waiver is in great part now due to Secretary Scott's leadership on this. So we look forward over the next year to report better ways of responding to this. So it's truth on both ends. Yes, it's been difficult, which is what they're telling you. No, we don't accept it. Yes, we're going to change how we do it moving forward.
Well, as our conversations have reflected in just the last couple of weeks, it is music to my ears to hear that everyone is playing better in the sandbox, right? And we're all on Team Maryland. So I can't thank you enough, especially for our most at-promise children. So with that, I apologize, Chair. I went on a little much. Thank you.
No apologies needed. Thank you, Madam Vice Chair. I just have a couple of questions to close us out, please. So on contractual services, so Appendix 3 of the DLS analysis, page 43, line 8, it notes a $4.8 million increase in contractual services. Can you provide just a little more info on that, please?
So contractual services falls into a number of different categories, including, for example, our MD Think Agile contracts, contractual services through security and software and other things. So what I would request, if I may, Madam Chair, is to go back and provide you a breakdown that better illuminates this particular line, because this reflects a lot of different things that fall into it.
That makes perfect sense. I really appreciate that. Thank you so much. So my last set of questions is regarding the FFPSA evidence-based practices. So pages 29 through 30. I'm going to flip as well. So on page 29, you mentioned, or the DLS analysis mentions that you're working on conducting a comprehensive assessment with LDSS and stakeholders to determine if other evidence-based practices could be included for better prevention services. I'm wondering if you can please elaborate on the timing or any concrete steps that are occurring for that.
Sure. Why don't I take it for 10? So a way to think about this, Madam Chair, is that I was telling my colleagues a minute at the beginning of the hearing that I wish I had a Harry Potter wand that worked for these things that I could wave and overnight we could fix these things. It's going to take some time. So think about it in terms of a ladder, right? So if you think about the highest rung, it's the most complex kinds of evidence-based care that have been tested across the nation, right? And we know that the Dana Jones program works this way for 13-year-old girls. That's evidence-based. But along the ladder, right, are different ways of trying new ways of serving 13-year-old girls. Some of them might be working with kin moms or kin grandmothers. Some might be working with an after-school-based program. The ladder from trying out new ideas or rapidly prototyping idea to best practices to evidence-based practice take years. And in Maryland, we have not, over the last decade, been as deliberate and intentional about making sure that we have the most robust set of options available to all of our local departments of social services and all of our providers. You'll notice that in 2 parts of our testimony, including when the acting chief financial officer spoke, we only have a few qualified residential treatment program providers, QRTPs. But that is the new game in town in terms of the federal government. To receive Title IV funding long term and to be able to draw down the most robust set of financial resources, we have to have a set of services that meets the standard. There's actually a clearinghouse called the FFPSA Clearinghouse that includes things like multisystemic therapy or MST, which are proven to be relevant models to best serve kids with a particular set of challenges. So as we think about evidence-based practices, we are doing all that we can to quickly catch up about over a decade of not really partnering as effectively as we could with our providers. Last summer, we convened all of our contracted providers for the first time in Maryland in over 4 years. That predates COVID, which would beg the question, why is DHS and the Social Services Administration not more regularly and more robustly engaging with the very providers who are responsible for caring for our kids day in and day out, right? So turning that culture around, turning that expectation that providers will be our partners, not just because we have a contractual and financial obligation, but because we expect raising the bar of excellence around using evidence-based practices. One of the things that the Principal Deputy Secretary and I have been doing in concert with the providers is being very honest about this. You can't just become an evidence-based provider overnight. It takes a lot of work. Training up your staff, recruiting that staff, making sure they understand the model more robustly. That's not just their responsibility, it is ours as well. And we have to take responsibility for that new way of making sure Maryland has a robust set of EBPs ready to go. It's going to take us some time to get there, but already we're making some progress. So I wanted to make sure we lifted up both the context, what we've done, and where we're headed moving forward. I imagine some of our providers who are here today will probably speak to some of their efforts in partnership with us as well.
Awesome, thank you. Just last question that's related, and you spoke a little bit about this in your opening remarks, Mr. Secretary, but are there any plans to expand the current programming like parent-child interaction therapy or functional family therapy, which has been shown to help reduce entry into the system? And if so, can you please comment on any efforts to get these programs federally reimbursed?
Sure. Go ahead.
Oh, go ahead. So part of what we're doing, and just to add to what the Secretary, this goes to the same answer what he was saying before, we are in the throes of developing our federal plan. So all of these have to be approved through our federal plan. Maryland has a approved prevention plan, but we have to submit to the federal government every 5 years. And so our new prevention plan is due June of 2020, is due this year, 2024, and as well as our Child and Family Services plan. So there are 2 plans, you know, it's the federal government. And so part of our prevention plan is just that. It is FFTA, it's also PCIT, all of those evidence-based programs that are in. We currently have those throughout the department. Throughout the state. We're looking at how we scale those up. We, in Anne Arundel County, we work with Catholic Charities. There are other providers in other parts of the state in order to do these practices. And so in this year, we will submit our plan. We've had regional meetings with all of our local departments of social services, because as you would imagine, in different regions, we will need different services to appropriately address the needs of that community, of those families, and of those children. And so we will look to what can we scale and how fast we scale it and where we scale it, and then make sure that it's reimbursable because it will be in our approved plan that we will submit to the federal government.
Okay. Oh, I'm sorry.
No, I was
Mr.
going to say,
Secretary.
using the magic wand, when all that works, that means we can draw down ever more federal dollars because they're in the Family First Prevention Services Act clearinghouse, and that is an approved evidence-based practice. So that way, the balance of general fund investment will be leveraging significant amounts of federal dollars. To get there will take some time, but 100% dedicated to getting there.
We love to hear it. Thank you. All right. I think that concludes our questions to the DHS team. Thank you so much for all of your important work for vulnerable kids and families across the state. Really appreciate it. We do have 4 individuals signed up to provide oral testimony. Consistent with our committee guidelines, public testimony will be limited to 2 minutes each, timed by our amazing counsel to the committee here, Joe. So I'm just going to call all 4 of the individuals signed up to the table, and then you can proceed in whatever order you wish. So we have Nicole Grainer, Robert Bassler, Kevin Keegan, and Lucienne Parsley. See, 3 people. Are we missing one? Okay, well, you may proceed in whatever order you wish, and the clock will begin when you begin speaking. Please introduce yourselves for the committee so we can mark you off. Thank you.
Good afternoon. My name is Nicole Grainer. I'm the Assistant Policy Director for the Community Behavioral Health Association of Maryland. CBH is the leading voice for community-based behavioral health providers serving vulnerable Marylanders. Our 86-member organization serve the majority of those in the public behavioral health system, providing outpatient, specialty, and residential treatment for mental health and addiction-related disorders. Across the children's continuum, CBH represents half of the QRTP providers in the state. Our members have clinicians on the ground in over 2/3 of Maryland's schools, delivering everything from prevention to specialty services, and they work across the juvenile justice and child welfare continuums of care, delivering evidence-based interventions, treatment foster, independent living, and residential treatment to youth involved in Maryland's child welfare system. For decades, Maryland's efforts to implement rate reform have stalled, and opportunities to access federal financing have gone untapped. As a result, providers' ability to provide specialty and flexible services has declined, leaving a child welfare system making placement decisions based upon adult needs and available beds and not the needs of children. It is no secret that the current administration inherited a department with an array of pressing needs and competing priorities. We are grateful that Secretary Lopez and his team have prioritized child welfare rate reform. While rate reform is a priority in this year's budget, we want to emphasize that for change to truly take place, it must remain so in future years. We know implementing rate reform requires changing practices and operations on both the department and our provider side, and that change rarely comes without challenges. We welcome the commitment to continued conversation from Secretary Lopez and his team. CBH and our members are excited about the opportunities to improve the delivery of services to Maryland's vulnerable children through rate reform. We respectfully urge you to support Governor Moore's SSA budget as proposed, rejecting the DLS proposed cut of $7 million that is needed to fully support rate reform. Thank you.
Good afternoon, Madam Chairperson, excuse me, members of the committee. Sorry. Thank you. My name is Robert Bassler. I'm Associate Vice President of Arrow Child and Family Ministries. Arrow again, provides multiple services to at-risk youth throughout the state of Maryland. We provide qualified residential treatment programs, treatment foster care, evidence-based community mental health programs, services to transition age foster youth, and special education. You have my written testimony, so I'd like to use my time just to really emphasize why fully funding rate reform is so vital for providers. Arrow has been providing residential services to Maryland youth for almost 25 years. I've been responsible for the programming since 2018. Since 2018, with the rate structure we have in place, year after year, Arrow's residential programs lost money. we lost money essentially because we were investing in things like evidence-based practices, nursing services, additional therapy services, trying to pay competitive rates with other programs such as hospitals and schools. And the rate setting structure wouldn't allow us to make those kind of investments. And I think what we've started to see is programs either scale back services or shut down because they don't have the resources to continue losing money year after year. This new rate reform will allow both programs to be financially stable, but also make the kind of investments that the youth, the secretary, and his team were talking about serving need. These are the most complex kids in the state of Maryland, a lot of cases who need really comprehensive help. And so I really urge you to reject the reduction of $7 million and fully fund the governor's budget for rate reform. Thank you.
Madam Chair, members of the committee, my name is Kevin Keegan. I'm the Family Services Division Director at Catholic Charities. And Vice Chair Jones, I appreciate your call out of New Pathways. It's nice to see you. We are very much appreciative of the budget increases related to private provider rates given the long-standing challenges within our agency rates process over the past really dozen years. We at Catholic Charities operate a QRTP as well as 8 outpatient behavioral health programs. The vision set forth in Secretary Lopez and his leadership team is setting Maryland on the right path moving forward with an understanding that we can no longer operate in silos. The reason kids are coming into care is behavioral health related primarily. And it's that interplay, especially at the local levels, between the local departments and the providers who are doing outpatient behavioral health services that are really the critical supports that families are needing. And as an example, Madam Chair, I appreciate your call out of Deputy Secretary Carnitra White, who at that time was the director of Anne Arundel County DSS, who reached out to our clinic in Millersville to say, can we work together on PCIT? And we've since not only rolled out PCIT in Anne Arundel, but now in Allegheny and Baltimore counties. And no kids that have touched the PCIT program have entered into the child welfare, into the foster care system. Main point being, I think that the administration here really has a great idea of what they're doing, what direction they're heading. The partnership with providers is really remarkable. The change from previous years is palpable. And for those reasons, I really urge the committee to not support any cuts to the budget. They know what they're doing. They're drawing down federal dollars. I mean, I really have immense confidence in this administration, and I urge you to as well, and to make sure that they receive the full allocation.
Thank you so much. Do any subcommittee friends have questions for our panelists? All right. Thank you so much for your testimony.
Thank you.
One last attempt, Lucianne Parsley with Disability Rights Maryland. Okay. Well, that concludes the testimony for today's budget hearing and our budget hearing in general. So thank you so much. We are back in for subcommittee on Wednesday at 1 p.m. in this room. Continue to follow along. It's good times. Have a good day. Bye.